Hi everyone. So I hope you enjoyed that EKG video. And now what we're going to be taking a look at is how doctors can use EKGs to detect any kind of abnormality in the heart's electrical activity. So doctors can use this to detect any past heart attacks, or to see if the heart is pumping like it needs to, because remember, if something's wrong with the electrical activity, then it's going to cause problems with the heart's contraction as well. So let's take a look at the atrial flutter. An atrial flutter is going to be where the exactly what it sounds like, where the contracting is very arrhythmic, or yeah, pretty much arrhythmic. The atria are attempting to contract, and it says it's attempting to contract at 200 to 400 times per minute. So what happens is that they are contracting so much more faster than the ventricles are contracting. So usually you have about, I think, 4 atrial flutters per one nice ventricular contraction. So this can go on for years, sometimes with individuals not really realizing that it's happening, and eventually it can turn into something called atrial fibrillation, to where the action potential gets more chaotic, and it is going to be where the atria are going to, they actually are going to contract more irregularly. So it leads to a more irregular heartbeat, and can lead to other disturbances as well. So this is going in and taking a look at an ECG of an individual with atrial fibrillation here. So probably many things that you can see going on. Of course, QRS complex is upside down, and if you follow along with it, there's no real distinction between that P wave and the T wave. Don't worry, I'm not going to make you analyze abnormal EKGs or anything like that, but it's kind of, again, it's one of those interesting things, right? You also have something called premature ventricular contractions. These can be from stress, stimulants, sleep deprivation. Anything like sleep deprivation is going to definitely cause stress. Sleep deprivation is probably going to make you want to take stimulants, right? So all of these things can cause premature ventricular contractions. And really what you have is an abnormal action potential within that AV node or the ventricles, because if you think about, the problem is there at the ventricles. And it says unless it occurs in large numbers, then it's not going to be detrimental at all. Ventricular fibrillation is going to be very similar in how it works with atrial fibrillation, except it's in the ventricles, which is not something that you want happening in the ventricles. With the ventricles, you need a nice solid contraction, not this little fluttering or this kind of irregular chaotic action potential that's occurring. You need something that's nice and rhythmic. And so usually ventricular fibrillation is going to be life-threatening. And what happens there, it is the rapid repetitive movement of ventricular muscle. Contractions are not coordinated, so the heart's not able to pump out all of the blood from the ventricles. It's able to pump out some, but not enough, and it can lead to cardiac arrest. So with some of these conditions, they will use the AED in order to kind of shock the heart back into a normal synchronous rhythm after that. So what we're going to take a look at next is something called the cardiac cycle. This is going to allow us to go through and look at how blood is going to move through the heart. What's happening with the pressure inside of the heart, because the pressure is going to definitely change throughout the heart as it's moving blood. We're going to take a look at what the valves are going to do. It's taking a look at where blood is going. So that is the next section. So until next time.